Hi, this is Arin from SimplyDoc. Just wanted to share with you some of the insights we're getting around telehealth in the time of COVID-19. It's March 25th, 2020 right now. I'm in Virginia. We're in our second week of quarantine here. Who knows how many to go. And well, there's a lot of interesting conversations that we're having right now around telehealth, and just want to share with you some of the insights that we're getting from that. So first, let's take a look at a couple of trends here Google can help us with. If you look at searches on telehealth apps up 500% over a year ago. So lots of people certainly looking for how they can use telehealth in their practice. And then on the consumer side too, people searching for online doctors. So they're out there looking for you. They're looking for a way that they can meet with doctors without going into the office. And so we're certainly hearing through our work at SimplyDoc a lot of interesting stories. Came across a small practice in Kentucky who's recently switched doing 100% of initial patient consultations through telehealth. I was speaking with somebody earlier this week, talked about their practices seeing a 20% drop in patient visits due to people canceling out of fears of coming into the office. Frankly, 20% sounds kind of low to me. I would think that I'm sure that there are plenty who are seeing a larger drop than that even, and I'm sure that depends on the region you're in and how bad coronavirus has spread there at this point. But definitely a lot of people on the medical practice side as well as the patient side very interested in telehealth right now. Our traffic at WebRTC Ventures, which is the parent company of SimplyDoc, up 90% over the last week, and seeing over 1,000% increase in leads talking to us about telehealth. And as the message about SimplyDoc gets out there, I'm sure that will only continue to increase. Like I said, definitely regional. Saw an article in Becker's Hospital Review today talking about in New York, where at this moment there's some of the most serious number of cases here in the U.S. They're seeing a 312% increase in telehealth visits there. So a lot going on in the world as a whole around COVID right now. We're talking with medical practices in the U.S. and internationally about helping them get out a telehealth solution as quick as possible. Some of the insights that we're getting from those conversations, we like to pitch our solution at SimplyDoc as being very customizable. We can customize the workflow to you. But right now, people just want to get out to market as fast as possible. So definitely the conversations that we're having with prospective clients are about how quickly can we get this out there for our medical practice. And we can come back later. We can customize the landing page. We can make it look prettier. We can customize the workflow for you. But right now, let's just get out there because we've got patients who need this now. And also with just a lot of patients using telehealth for the first time as part of this experience, the ease of joining that call is really important too. So we were talking with one medical group about reaching a lot of disadvantaged patients through texting to their cell phone and making sure that they're able to get into the calls really easy without any training, without downloading any apps, and in some cases not with complete English fluency or technical experience. So everyone out there right now deserves treatment, needs treatment, and if they need screening around COVID, being able to do that regardless of their location or anything like that. So some of the things that we've really been working on, rolling out a new version of our SimplyDoc platform that allows you to invite patients to meet with you by SMS text message so that the doctor can start a call, just type in the patient's cell phone number, and then a link gets sent to them, and then they're immediately into the call without creating an account or anything like that on the patient side. So ease of joining that call is really important to people right now, and we're certainly trying to respond to that as best as we can, as quickly as we can, because everything's truly a crisis right now and needs a quick response time. And because of that, the doctor's time, doctors have always been busy, of course, but the time for those healthcare professionals is really a priority right now. So thinking about how can you do telehealth so that the doctor's not waiting for the patient to join a call, for example, or scheduling visits is great. That's something that we offer, but a lot of telehealth right now is really an on-call or an urgent need type of situation. And so making sure that really respect the time pressures of those doctors right now and get them in and out of these calls as quickly as possible. So that might mean that the call is facilitated by an admin staff or a different medical professional in the office, and then when they bring in whoever their expert is on COVID screening or whatever the concern is being discussed in that telehealth visit, that they can bring them in once the patient's there, get through that consultation as fast as possible, because then they need to go talk to somebody else. So yeah, I think that telehealth is needed now more than ever. This is an area we've certainly been working in for a number of years, and a lot of people have, but we're definitely at a turning point. Practitioners that we're talking to, the other healthcare professionals we're talking to, the other healthcare IT professionals we're talking to as well, basically everybody agrees this is a real turning point in social awareness and acceptance of telehealth, the importance of telehealth. Obviously, we all hope that COVID-19, that this crisis that we're in goes away as quickly as possible, but I do think that we're certainly looking at it. Everyone we talk to seems to agree with this sentiment. Telehealth is here to stay even after we get rid of the coronavirus, hopefully sooner rather than later, but telehealth is going to be sticking around for that. So, the people we're talking with now, we're definitely encouraging that sort of short-term and long-term view. Short-term, how can we get something out as quick as possible that even if it's not exactly what you want in a telehealth solution, it's something you can start to use ASAP, but then also still thinking ahead to what is the workflow and the way that we want to use telehealth going forward, because even after coronavirus passes, there will still be telehealth, and I think there'll be a greatly increased need and expectance, if that's a word, that our patients at our clinics are going to expect that we have a telehealth solution for them so that they can stay out of a waiting room filled with germs, even if, and hopefully someday in the future those are not germs related to COVID-19, but just germs in general. There's certainly going to be an awareness around that. So anyways, that's what we're seeing this week at SimplyDoc in the conversations we're having with people around telehealth. Certainly, happy to talk with you as well. Just reach out to us at simplydoc.com. And stay safe, everybody.